was able to be on the call today, and not sure about Dan either, but hopefully he'll join us later. So I'm going to just try to keep it short today. I know we're all scrambling to hopefully have a few days of rest at the end of the week. And just thank you once again for joining. Okay, so we have our DOH mission, which I'm sure you've all memorized at this point. Our basic data overview here is still kind of an increase in the 7-day testing positivity. So, and I know this isn't a surprise, we're in another surge. So again, the orange line is percent positivity and the red line is cases by day. This is from the CDC COVID data tracker. So just keep waiting for that, that hump to happen. Our infection rate, the R effective, is 1.14. That is down from last week when it was 1.18. So hopefully that's a trend we'll continue to see. And again, as it gets under 1, then cases, you know, the surge starts shrinking. The main thing I wanted to share here is the statewide progress. So I'm on the good news side, the statewide progress for ages 5 to 11. And this isn't even up to date as of today, but we did hit 10%. I think it's 12% now, with 15,000 doses given last week, and basically, you know, 4 times increase from, you know, the first week of giving vaccine. So, you know, really just the usual tremendous rally and effort from everyone across New Mexico. The weekly vaccines administered in New Mexico reached 71,000 doses. I end up sort of tracking Thursday to Thursday is how this graph is. So sometimes that number will change if you're tracking, you know, with slightly different dates. But the basic message here is just look at this incredible increase. We were down here at 25,000 doses a week before the boosters got approved. And then between boosters and kids, it just keeps going up. So again, also have had a tremendous response from people across New Mexico. The total vaccine doses administered in the US versus New Mexico, again, we track right along with what seems to be happening elsewhere in the country. And this one even has kind of a slight slope suggestion that maybe we're, you know, on a little faster pace than some places. This is the vaccine progress for all the age ranges. So again, we are at 85% of New Mexicans have had at least 1 dose and 74% fully vaccinated. You guys can look at the numbers, but just continue to, you know, at this point, making slow progress in the ages that have been eligible, but continue to, you know, fairly rapid increase in the in the 5 to 11-year-olds, sorry, 12.7%. So the booster, so updates that happened this week, or in the week since we last met, I think shortly after we had this meeting, the FDA did issue an emergency use instructions on Pfizer boosters for people vaccinated outside the US. And I know this has been a topic that's come up a fair number of times on this call, so I just wanted to make sure to call it out. And basically, for anyone who's gotten a WHO approved, but not FDA approved vaccine and are fully vaccinated, so they've had however many doses are recommended, they are now eligible for a Pfizer booster or a Pfizer additional dose in the moderately to severely immunocompromised group. So, and it's for people, for the boosters also in the 18 and over group. So it's sort of a new group of people eligible for boosters, and was specific to Pfizer full dose, the 30 microgram. The other thing that happened in booster news is that the CDC on Friday did approve boosters for everyone ages 18 and older So basically following what had happened the week before in New Mexico and other states and federal partners. And what's just interesting is they did continue to have this separation between who should get a booster and who may get a booster. So for the should get a booster, it is ages 50 years and older or 18 years and older and live in a long-term care setting. And then may get a booster kind of for everyone else 18 and above. And for Pfizer and Moderna, it still needs to be 6 months after completing the primary series. And you still can get the mix and match. Nothing really changed for Johnson and Johnson. But what's interesting in thinking, and I apologize for this slide, this is cut from my favorite page, the interim clinical considerations for use of COVID-19 vaccines. But just to think about risk benefit in people who are under 50 and considering a booster, but level of community transmission is one of the risk factors that you should consider. And I think that puts us right back in, what's going on in New Mexico right now really would sort of should push providers to recommend boosters for people. But there's lots of other things. I won't read this all to you. But lots of other things that people can consider, most of which we have been considering. The booster dose numbers continue to hold steady. We actually had a 17% increase over last week in the number of boosters given. And this is booster progress by primary series. So this is our total. If you take eligible people, the number on the dashboard again just has a denominator of kind of the whole population 18 and over. But if you take the people who are actually eligible by age and by the date they had their first vaccine, that's what this kind of second row is here. Then this is the number of people that have been, the percent of people that have been given boosters, with a total of 36%. Last week it was 31%. So new people become eligible every single day as they hit that 6-month mark, but we're still keeping pace with that, like really vaccinating, continuing to vaccinate people that have already been eligible and keeping up with the new ones. The vaccines in 5 to 11-year-olds, I thought this is interesting. Our data team mapped, the red line is the rollout from 12 to 15-year-olds, and the blue line is what's been happening with the 5 to 11-year-olds. So really seeing a similar curve. I'm trying to remember, but I think this tiny little plateau we saw here was probably Memorial Day, because the 12 to 15-year-olds got approved about 2 weeks before Memorial Day. So we're probably going to have a similar situation happen with Thanksgiving happening. But it kind of, as we had thought, the curve mirrors the 12 to 15-year-olds. So far so good that it isn't worse. It would be wonderful if it was better, but it kind of fits with what was expected. Also, CDC reporting on the 5 to 11-year-olds, and again, I didn't look today, but it hasn't been in their usual kind of map of states. But this is data pulled from the CDC at this usafacts.org. And looking at nationwide, there's in the less than 12-year-old group, about 6% of the population has received at least 1 dose, and we're at 12% of the population. So again, good job, team. This one is just left over from last week, but just continue to remember there are 2 different formulations and they are not interchangeable. Vaccine messaging update. This actually doesn't have much to do with vaccine, but I just did want to make sure everyone was aware of this FEMA's COVID-19 Funeral Assistance Program. This is a flyer about it in English and Spanish, and I can send the PDFs out, but just wanted to call that to people's attention as a something that you can offer to patients. This one we talked about last time, the Swiss cheese slide. I actually saw there have been many iterations of this. It's kind of fun to see what people have done with this, but just the idea that we have to continue to put multiple layers of protection between us and COVID, no silver bullet, including our next one that's coming, which will be the oral antivirals. And that brings us to the antivirals update. Nothing that I have new from last time on this, but just to remind people that it is kind of right around the corner. The molnupiravir, the Merck oral antiviral may be approved, really any day now. I can't remember which day the FDA is meeting on it, but CDC has told us a tentative availability date of November 30th. And again, very limited supply. So somewhere between 600 and 2,400 doses anticipated in New Mexico. And if we're looking at our daily case rate, you can sort of put together that there will need to be some fairly strict prescribing restrictions put on it at first. And hopefully, as time goes on, that supply will get better. But it's probably going to be pretty rough at the beginning, kind of navigating that with patients. The patient course is 5 days and must be given within 5 days of symptom onset. And then this is the AstraZeneca product for PrEP. This has a much narrower indication, but sort of same thing, limited supply, also much more limited audience. It's the IM injection, probably indicated every 6 months, and that's more of a prevention in people who are severely immunocompromised. Okay, then updates from the immunization team. And Joelle wasn't able to be here today, but something new that did come up is CDC has said, limitless supply, just order what you want. And, that's been great. And then all of a sudden we put in our order last week, statewide order, and they were like, hey, no, we can't fill this. So that has been worked out, but basically, they did allow us to have more Moderna doses. It was specifically around Moderna. We sent them all our data on the number, our increase in vaccines, increased vaccine demand, how many people are eligible for Moderna. But until we really understand what's driving this, we are just trying to message people to be as efficient as possible with opening the vials. I know we've had the exact opposite message for a long time, and we still want every opportunity to vaccinate. But if there are ways to group patients together so that we're wasting less, I think in the next 2 weeks that will be important. Again, we can remember to offer people Pfizer or even Janssen as a booster option. I mean, lots of us, I think, sort of have this experience that the Moderna people really want to stick with Moderna, but sometimes it's just they don't know that they can switch. And I think CDC continues to say that they really, they don't have CDC has no guidance on which is the better option. And then the other issue, which we've mentioned on the call before, was updating the inventories in NMSIS and Vaccine Finder. In Vaccine Finder, and I just want to say thank you, because in NMSIS, we really had a pretty good inventory that matched our state doses. In Vaccine Finder, we do have some federal doses, like through the federal pharmacy program, that didn't seem to be quite, accurate. Like stores were reporting that they didn't have doses on hand, but Vaccine Finder was showing like thousands of doses on hand. But that was identified as one of the issues that CDC kind of put a pause on our ordering. And so just, if you ever are sort of doing these tasks and feeling like they aren't important, they are incredibly important right now. And again, thank you, because overall our inventory looked good with a couple of exceptions. And if I know staff turns over and sometimes these threads are lost, please reach out to the vaccine program if you have any questions about updating these inventories. But CDC is watching. For assistance, again, on anything vaccine related, we do have our NMSIS help desk, but we'll answer more than just NMSIS questions, email, and really trying to keep patients off of this line and really keep it for provider service. So please be good if you didn't share that with patients, although some have found it already. Email us at the COVID.vaccines email, and then there are some resource guides in the NMSIS reports section. The QR code update, unfortunately, there was some Microsoft glitch, and so it had to get taken down. Some people had really started using it. It worked great for a few patients that we knew were looking at international travel and just kind of waiting with bated breath for this feature. They were able to get it and travel. But anyway, then some glitches happened. We had to take it down. We're really hoping that next week it will be back up. But probably QR codes visible on the patient side, the vaxviewNM.org, won't be available until January. We were hoping that would be a December thing, but looking more like January. And when this all gets straightened out, then the QR resource guide will be sent out. That's just my plug for the favorite CDC page. And then Chris, are any RTS updates? I think I didn't update this slide.
Yeah, no problem. I'm going to quickly steal the share and then I'll give it right back.
All right. Oh yeah, the new map.
Yes, I think that will be helpful. So we are able to, so what we used to do on the public side of things is just show the locations that currently had availability. We need more booster capacity in Santa Fe. At some days they were only showing 1 or 2 locations. So we're also pulling in every location out there that's administering vaccine, and essentially if they're full, we're just putting a "this event is full" button at the bottom. Otherwise they can still log in and schedule an appointment at locations that are a little bit more that have capacity. But up in Santa Fe, you can see, like, for example, this is today. If you go to tomorrow, obviously nothing on Thanksgiving. 26th, they're pretty full. So it allows the public to really see who's got what available and when. We also introduced a new feature in the app that hopefully will make scheduling a little bit easier. So let me just quickly access my profile. And I give you all permission to see my record along with my daughter's record. So if you look at scheduling an appointment, by default, if it's a child, Pfizer for Kids locations will automatically be turned on. If it's an adult, Pfizer, Moderna, and Johnson & Johnson will be turned on. We had some feedback that checking those things on may be a little confusing. We also have this new filter availability within 1 week, within 2 weeks, or any time. So this will give the public really what's available this week if they need to get a vaccine, if they can within their community that week, within 2 weeks, or any time. So those are the main changes that we've added the last couple of days to hopefully help move things along. Also, just to give you guys an idea, we put this together for Dr. Durham and the ops team to really understand our booster capacity. And so, we keep talking about, please add availability, add help, and specifically Santa Fe right now, right? So from the 23rd to the 30th, we only have 15% of our spots available. That's 210 Moderna completely available for this week. If you extend this out through the 7th, that number drastically, well, it doesn't drastically drop, but it doesn't increase much. And it's primarily driven by 2 days, the 30th and the 7th. So this is, we put this together so that we could get some real-time data in terms of where the capacity issues for boosters are. And if you look statewide, we're doing okay. We have 32% capacity. But once you start drilling into these different regions, there are some regions that are really hurting for capacity. So if you have a question about your particular region, we can run these reports for you so that you can see essentially where the demand is, and hopefully set up some more appointments. And I do echo Dr. Durham's gratitude. It seems like a small word for what we feel for you guys in terms of all of the things that you've done and all of the work that you've done. And it's got to be tough hearing us say capacity, capacity, capacity when you're at capacity. We just stare at these numbers all day long, and we're trying to figure out how do we move the public to locations as efficiently as possible. So once again, insane amount of gratitude. If you can up your capacity, that would be great. If you want to know what the current capacity levels are within your region, within the app, we can share that data with you as well. Other than that, I'll turn it back over to Dr. Durham.
All right. And just a reminder, these are, I mean, we do know there's some people not in the app, and that's not reflected in these numbers, but it gives us kind of a snapshot of availability. So, all right, let's see. I think that we are just have my last slide. Thank you so much. This is in Dublin. I didn't go there, but thank you, internet. Just thanks to everyone for all that you do. And I'm going to stop sharing, and we can see if people have questions.
So Dr. Durham, we can, Karen, as we open up the chat here, if you want to just jump on board and ask your question real quick, you're more than welcome to.
Did you say me, Karen?
Yes, Karen Brown.
Okay, hi, thanks. So I'm from First Choice, a 9-clinic FQHC. So it's a little bit different situation, I think, than a lot of folks on the call. But one issue we're having is we really love the DOH app, helps with getting all the doses that folks need timely. So we really enjoy using the app, and it's great for scheduling. We also use the paper form of the pre-vaccination questionnaire. And so what we were wondering is, if you use the DOH app, you have to go in and put the questions in again. So we look at the paper form and get the pre-vaccination questions, but then to use the app and document that we've given looked at the questions, we have to enter those again. So we were wondering if there was a way to maybe just have a box that we could attest, yes, we've asked these questions, it's in our EMR. We like having the questions to go over in person and to have as a documentation in our EMR, but it's kind of like double entry in a way, because we have to then also put it in the DOH app. So we were just wondering if that would be a possibility, if it would help anyone else.
So we had this request early on, back in March, April, about bypassing the medical questionnaire, and at the time the decision was made to enforce it, because when you hit submit, there's an electronic record that yes, it was submitted. We can, Dr. Durham, we can talk with Dan and the ops team about potentially bypassing it now if you guys feel like we're at a stage where we can do that. So technologically we can do that. It just depends on what DOH team wants to do.
Well, it is just something to think about. And, we're trying to do on-demand vaccines as we're doing primary care, right? So streamlining it as much as possible for the staff that are doing it, would be helpful. So I understand the reasoning, but maybe it would be worth another look.
Yeah, absolutely.
We'll definitely do that. Thank you. And, I think it is,
much.
things evolve. So, how people use the app has changed. And so I think it's always good to revisit.
Thanks so much.
Yeah. I want to address in the chat, Julie talking about redistribution. And I did think back to having said that last week, that we're really trying to get away from redistribution. And then I think Joelle spent all week, because we had these limited, suddenly many fewer doses coming in than we thought, spent lots of time redistributing around. So be careful what you say. And I do think, ultimately the goal is definitely to support everyone who wants to do vaccine. And if that means some redistribution, I don't think it was a hard no. It's just, again, as vaccine can live in the fridge longer and, to kind of maybe where it's possible to try to cut down on that redistribution. But I think it's still a good option for people with small numbers, but we appreciate it, those are important people to vaccinate too. So.
And then Rachel, Mark, well, is there any other guidance or any other details that you'd like Dr. Durham to expand on there, or is that good to go?
Yeah, no, that's fine. I just wanted to sort of call out the small practices. I'm a family medicine physician, and we have a 2-doctor practice, and I find that our participation has, we're really dedicated to it. Our patients want it, our patients need it, but we don't vaccinate large numbers because we just can't. We literally have a staff of, I have 2 front staff, 3 medical assistants, 2 doctors, that's it. And we're still managing to vaccinate 50 to 75 patients per week. And of course, when I see that our patients are calling and we're like a month out from Moderna, I have to open up another, morning slot of 20 or 18 is really what we're doing, which is huge, and I know you're still in this like large volume push, but if you want all primary care offices to do this eventually, like I can't choose between, okay, I can vaccinate 18. Oh, but there's a need. Now I've doubled that to 30. So now I'm on 36, like in a manner of minutes. And I just think we need to come up with we need smaller dose vials. Like I just can't even imagine this long term without smaller dose vials, or we need a way to I'm literally a block away from Letrado Street in Santa Fe downtown, and I just really would love to go and pick up 5 doses and walk them back to my office. And we haven't been able to vaccinate any children here because I can't line up 10 kids at one time. And I know we're not in the stage where you're really just trying to get volume right now, but eventually we need to figure out how to get primary care doctors the dosages that they need, that can work in day-to-day practice.
Yeah, no, I hear you loud and clear. And I think, that feedback has been given. I think the manufacturers are also just like, we have high demand. So overall, it is more efficient to put 10 doses in one vial, but like absolutely for the ongoing, ongoing effort, it's going to just have to get down to fewer doses in a vial. So anyway, but we are really happy to work with you, and that maybe came across a little bit too strong last week. Part of the message is that the number of PEDS doses you can order, and again, I hear you that you're even under this number, went from 300 to 100. So for people who can do 100 doses in the 10 weeks it can be in the fridge, to do that, to order directly rather than to stick with a redistribution that they may have been doing when you couldn't keep it so long. So
right, and maybe just to add that you need capacity. If I could recommend this to my down the street private practice colleague, when we all did this, maybe the capacity wouldn't be an issue. But I know that there are lots of small practices that are just nervous about doing this and just don't even know how to even start. And I do feel like we're in over our heads, just with I'm thinking, why did we sign up for so much extra work? But we did. So
right, and we thank you for
Thanks.
taking that on. Yeah. And eventually this will be orderable, I think, in normal channels like this, and it is a question we've sort of asked the CDC, and, it doesn't seem to be on the radar, but, eventually it will be fully approved. And I imagine we'll go back to sort of ordering as we, order other vaccines. So it'll be interesting to see in a year's time where we're at, but it is a clunky system right now. There is no question, but we really appreciate everyone, like every dose counts. And so happy to work with people, that are doing small numbers and need redistribution. Rachel's got a comment in the chat. We did not go over it. The guidance for a 12-year-old. So there's a 12-year-old, let's see, what is the guidance for if a 12-year-old got a pediatric 5 to 11-year-old dose? Should they get the 12 plus for their second dose? So basically there is a couple, like I will say the overarching guidance is give the age appropriate dose. So if you're 11 when you get your first dose and then you turn 12 in time for the second dose, give the peds dose for the first dose and the adult dose for the second. So whatever age you are, give the dose that's appropriate. However, written into the EUA for the peds vaccine is this little statement that it's kind of the choice of the patient if they're going to, have a birthday between the first and second dose. They can elect to get either one of those doses for their first dose and either one of those doses for the second dose. So it is kind of, it makes it complicated, I think, always to not have really clear rules. If someone asks you, I would just give them the age appropriate dose. If someone's like, I really don't want my child who just turned 12 yesterday to get the adult dose now, that is fine. You can give the second dose, the pediatric dose. And conversely, if a parent's like, my kid's about to turn 12 in 3 days or 2 weeks, and I really want them just to get the full dose, that is okay, you can do it. If it's a vaccine error where you gave a 12-year-old the pediatric dosing, for 12 to 15-year-olds, you don't need to do anything, just give the age appropriate dose the next time for the second dose. And I'll just go on with the weird, like all the little pieces of guidance on this. But if you're 18 and over and got the pediatric dose, then you are supposed to just go ahead and give them the appropriate dose right then and there. Does that answer the question, or did I just confuse everyone on the call?
I feel like we need a Venn diagram.
I know, yeah, it is. The kind of take-home message I had was like, you can't sort of between 5 and 12, 5 and 15, there isn't there's really, give the dose, give the age appropriate dose. If there's a mistake, you don't redo anything. You just kind of do the right thing the next time, if that's sort of a way to summarize. All right.
So the next question here, Carol. Hey, by the way, Carol, I drove by that. It looked like you guys were busy. Saturday, 5 to 11, the addition of the thigh as a vaccination site is not in the drop down on the kids, only the adults. I will work with Katie to make sure that that is in there.
It did make us laugh that it was for the adults and not for the kids.
We'll get that. If it's not in there, we'll get it today.
Okay, and it was a great clinic. Yeah, it was pretty awesome. The vast majority of the kids had a great time there. So, and the adults too.
Yeah, 651. That's awesome.
Yep.
Karen Brown says, are there any updates about availability of monoclonal antibody treatment sites? It is difficult to schedule folks timely. Thanks.
Yeah, I mean, basically all the monoclonal antibody that we get into the state is deployed across the state. So yes, agree that there isn't a super easy way to schedule. The two resources, I mean, I've probably mentioned them before, but on the DOH website, there is kind of a national infusion center site that people are supposed to list their monoclonal antibody on that. For providers, it is another place where you can, it's helpful if you can go in and verify that you truly are like a provider in your hours, and to make it more accessible or more, I guess, functional. And then also, I think individual hospitals do have, I mean, Presbyterian here actually has a really nice page on monoclonal antibody, I think, with a fairly simple 2-page referral. So thank you to anyone on the call who's put that into place. But it's kind of a centralized system for finding information at multiple of their sites. But overall, it is, for the number of cases we're having right now, just not enough. And unfortunately, that is also an allocation thing. That, federal government allocates a certain number. So any thoughts people have? I mean, we do have a great pharmacy team also who can help you set up as a site if that's, something that is anyone is considering. I mean, obviously that's kind of a heavy lift, but definitely let us know, or anyone who has good ideas or secret resources out there, please let us know. All right, and I think Tanya's had her hand up for a while.
Can you hear me?
Yes.
So a question and then a comment. I've been referring quite a few people for monoclonal antibodies this last week. Press requires a doctor referral, which is fine, but a lot of these people I'm referring have no primary care doctors. So I've been having to send them to like Sandoval Regional for treatment because they can't get in. And I hate overloading the ER, but they have gotten their treatment. The other question is, what happened with the sub-Q antibody treatment? Did they ever roll that out? Okay.
Yes, there are. So we have all 3 in the state, and there are sites giving the sub-Q. And it actually was kind of the #1 requested for a while. I think now some sites have found that, if there are places that are set up for IV, that actually patients kind of prefer that to it's 4 sub-Q shots. But I think some places like urgent cares that don't, have a big staff of people that can give, well, I shouldn't limit it to urgent cares, but there are some sites that don't have capacity for doing the IV and have been doing sub-Q.
Because they were talking about rolling out the sub-Q to EMS level. So I just hadn't heard any more on that from the EMS Bureau. I'll reach out to them.
Oh, yeah, that not a conversation I've been part of, but that would be interesting. And my guess is it's kind of probably bumping up against the same, like overall, there's kind of all doses have been spoken for, but I think if it does make monoclonal antibody accessible to people who otherwise are having a hard time accessing, other solutions are on the table.
I think part of the reason was when they reached out to EMS providers, it's a 2-hour wait with them, and that was one of their hesitancies. But I'm trying to look and see if I can set up a room. I had a really hard time this week getting some patients in, and I don't even know if one got in, and I can't find them now. So, but I know one of them did get in.
Great, and congratulations on your KOB4 Pay It Forward award. Very well deserved. Yeah.
Not happy with that. I am happy. We've done, as of yesterday, we did 10,070 vaccines out of Corrales, which to me is amazing. for a little bitty, sometimes DOH is there. So we got a great big team working, which is wonderful. Sometimes it's, 3 of us, maybe 4 of us. So we're excited.
Great. Thank you.
So I'm working with the Della in the chat about the PEDS vaccines 5 to 11, some adults. Dr. Durham, if you want to share your email with B. Nichols, she's asking for it. You're welcome to direct message that, or my advice would be to share your burner phone. I'm just kidding, everybody. Everybody in state government has my phone number at this point. Karen Brown says Highland Pharmacy does SQ for $300. They do not need a referral and do not take insurance. I'm assuming that means don't require insurance, or does that mean they do not take insurance?
They don't bill insurance. So even if you have insurance, they don't accept it.
Okay. Okay, I think so. Dr. Durham shared her email. Is there an extra H in that?
So it has my middle initial, which I didn't capitalize, but yes, it it is not a weird spelling of Miranda.
Awesome.
Yes. Thank you for clarifying though, because lots of emails have gone awry with that.
I was going to say we've emailed quite a bit this year, and I haven't even noticed that yet.
Yeah.
So, okay, team, is there anything else that you all would like to bring to the table for discussion? Going once, going twice. Okay, just a quick note, the Thursday provider meeting for the app-specific providers has been canceled due to a national holiday. Hopefully you all are taking the time off and getting recharged. And I hope you all have a wonderful Thanksgiving with your friends, family, and loved ones. Thank you for all you do. Dr. Durham, if you want to close us out, we can end the meeting.
Yep, I will just end with saying thank you once again for joining and for being part of this incredible effort for New Mexico.
Awesome.
All right, we'll
Have a
see
good
you in
one,
a week.
everybody.
Bye-bye.
Thank you.